All right. Well, good morning, everyone. It is 9:02. Thank you very much for being on the call live here this morning. It is March 4th, 2024, and we're off and running. Thank you very much for being here. We have another great start, another month here as we're wrapping up Q1. We are now working for 4/1 effectives, believe it or not. It's already March. I hope everyone had a fantastic weekend. And we've got a special guest from Dedicated this morning, Mr. Sean Thorne, who's going to be joining us in just a few minutes and giving us the good news. So as always, we need to start one foot in the classroom and the other one in the field at all times, because our mission is to improve the lives of our community with affordable health care. So let's jump into our training calendar here so you guys know what's going on this week. This week, it is a little light, not a lot of trainings going on. However, on Wednesday of this week, on the 6th, I want to point out that there is an Ask Al virtual coffee and chat session that we are hosting every Wednesday from 9:30 to 10:30. I've been getting emails about some newer folks coming on board, or folks that might have hit a roadblock, or folks that may be a little bit lost in the process, or maybe don't know what the next steps are. This is a fantastic opportunity for you to connect with Al, and he can digest what's going on with you particularly and how we can get you rolling and up and running. We've got lots of opportunities. You're going to hear some opportunities this morning from one of our partners, and we want to get you ready, set, and ready to run on that. So Wednesday, 9:30, please make it a point to jump into the session with Al Clancy. If you've already done that, there is a sales and marketing strategy session at 9:30 on Wednesday as well. This is going to be year-round selling. Really great opportunity for those of you that are selling or need some guidance as far as strategies are concerned. Wednesday at 11, Cigna's doing their virtual office sessions for Medicare. There it is. And then off to Friday the 8th. At 9 o'clock, we've got our What About HPM shop session. That is our quote and enroll tool. This is a live training with Mr. Tom Ryan, who can answer any questions you might have about our Medicare quote and enroll tool there. So just some sneak peeks. We've got some phenomenal new features that are going to be coming out for 2025. Last week, we had the honor of going out to visit our partner, Connecture, who helps us build the HPM shop, and they have some wild stuff that's coming down the pipe for enrollment season. So very, very excited to share that when it's official. But that is definitely something you're going to want to learn and be a master at. Remember, guys, this is a great time to continue to expand your knowledge base, great time for you to brush up on the technical stuff. So when AEP comes, you're not trying to learn new systems, okay? I've seen many of you abandon systems during AEP because you got overwhelmed. This is the time to do it. This is the time to get, on the same page with your technology to make sure that you're ready to go when the busiest time of year hits us, okay? So there it is. Remember, one foot in the classroom and the other one in the field at all times. All right. Moving on, we have some updates regarding Aetna. Aetna has extended the Hurricane Ian all the way until May 31st. So they're not the only company. Please check your emails. We do have a section in the gold key for SEPs. You can type in SEP and it should pop up there as well. But a lot of the companies are now extending this hurricane SEP all the way until May 31st, which is crazy. But, in case you bump into somebody that, didn't get a chance to change during AEP, didn't get a chance to change during OEP, you have all the way until May 31st. So if they were affected by the hurricanes and they still need to make a plan change to get out of their plan or join a plan, you have all the way until May 31st through Aetna. Now, keep in mind that this hurricane SEP is specific to each carrier. Not every carrier accepts it, and not every carrier has the same deadline to use it. So before you do anything with the carrier, just make sure that you're checking your emails and checking that SEP category to ensure that they're getting what they need coming in, okay? Also, talking about Aetna specifically, I wanted to mention one of the benefits that they have this year that's often overlooked, and that's their fitness reimbursement program. And the fitness reimbursement program, depending on the plan, can give you a couple of $100 to the member back in cash for things like gym memberships, if they play golf, if they're part of a tennis club or a racket club, if they're going to pickleball classes or yoga classes, anything that costs money that is directly tied to fitness, exercise, or training in any aspect. This is an awesome benefit that no other company has. So Aetna, for the win on that, you're getting your members, you can get your members some of that cash back that they're using for green fees or for yoga class or whatever it is that they're spending money on, fitness related. This is money that they can access outside of their plan. So it still has a silver sneakers program, which is fine, and that will continue to work. But this particular benefit is specifically to reimburse them for those activities outside of the silver sneakers program. And I find it fascinating that we haven't really talked about that much because that's kind of a big selling point for seniors. Some of them are spending a lot of money at that tennis club or whatever the case might be. So, if that comes up, make sure that you're aware of it. Okay, next up we've got Gold Kidney. Just some news from them. Last week they sent, last week was a good week for them. Last Monday we did a call with Gold Kidney. We had Katie Strout on the line, and she was talking about their particular plan benefits and the structure that they've got, mostly in West Florida, Jacksonville, and in pockets of South Florida as well. But one of the things that we saw last week is they announced an increase in their HRA, their health risk assessment form, paying you as high as $400 to complete an HRA on two of their products, the dialysis products that are available through Gold Kidney only. So $400 to complete an HRA. And I wanted to break this down for you because on the HRA products, the last one that we saw that was relatively high was WellCare's D-SNP product with $225. And I wanted to take a moment and let you know that these are not commissions. These are actually administration fees that the carrier is passing on to you for completing a health risk assessment form or a health risk analysis. And again, to reiterate how important these HRAs are, and I'm sure Sean will talk about this in just a little bit, but these HRAs is a snapshot of your members' health before they hit the clinic. So if they're changing doctors, this is especially important, or if they're changing health plans, this is especially important because the doctor's going to be able to see a snapshot of what's happening with that member even before they get to their first appointment. And this is like getting a running head start in your healthcare and connecting your member to a doctor that's already up and running and understands what's going on. So if you're not doing HRAs, shame, because it really is doing a disservice to your member. And it also is doing a disservice to your providers. So if you're working with providers and you're not doing HRAs, you're kind of hindering the process for them, and that's not good. So these carriers are spiffing you with administration costs in order to get that HRA done. And, seeing it firsthand, none of these HRAs take more than 10 minutes. I think some of them can be done in less than 3 minutes. So there's really no reason not to do them. And now that you've got companies that are paying as much as $400 to you to complete the HRA, it's pretty amazing. I will say that HRA, remember, this is an administration fee. It's not a commission, which means that even if your member disenrolls or changes plans, you get to keep that money just for doing that HRA form. So it's something to consider. Many of the health plans now are extending the time limit that you have to complete the HRAs, some as long as 30 days from the enrollment itself. So some of them are a little bit more strict. You got to have it in within 48 hours. Some of them, same time. Others are until the end of the month. They do always vary, but if you're using HPM Shop, the quote and enroll tool will tell you how long you have to complete the HRA once you get that enrollment process done. But regardless, you should be doing it as part of the enrollment process. So, you need to bake that into your time as you're going through your enrollments, bake that extra 3 to 5 minutes to get that HRA done. Maybe even 10 minutes just in case. But if you can get that done at the time of enrollment, I guarantee you will increase your income, you'll increase your retention with your members, because remember that the doctors are getting these HRAs, they're processing them, as soon as possible and calling the member and getting them in there, already knowing what medications they're taking, what challenges they have in their life, medically or physically, and that makes a huge difference to the providers. So, and then of course there's a commission side of it too. So I did some math this morning looking at, a gold kidney member that's being enrolled as a new to Medicare, you're making $611 for the new to Medicare rate. And then on top of that, you've got that HRA done at $400. That's over $1,000 in first year commissions for one member, So, just looking at that is incredible for spending, less than an hour with your member to get them enrolled. Okay. So wanted to put that out there and ensure that you understood how important these HRAs are. Again, if you need a training or if you need help with the HRAs, please let us know. You can send us an email at support@askhpm.com or give us a call. You guys should have the number. It's 844-696-3975. So with that, I would like to introduce our special guest today, Mr. Sean Thorne, who seems to be in the Grand Canyon of some sorts this morning. I'm very jealous. I wish I was there. But he's going to give you the good news about Dedicated and all the great things that they have to offer and ensure that you're up to speed with their amazing programs and physicians. So welcome, Sean.
Thank you, Justin. I appreciate the introduction. Always a pleasure to be working alongside and partnering with HPM. You guys are great partners. For everybody on this call, you've got a great upline with HPM. At one point I was actually sitting in your shoes as far as being an agent, and and at that time I wish I could have been a part of something like an HPM, because you guys really do things the right way. Really, I wanted to come on today and just update everybody on a few changes that have gone on, not only with in the Medicare and the MSO world, but also with Dedicated. Like Justin mentioned, my name is Sean Thorne. I am a market sales manager for Dedicated here in the Orlando area. It's actually a new position that has come about as far as us being able to serve this community and being able to serve the sales function. Previously, the MGCs or marketing reps that you had worked with at Dedicated were reporting directly to center directors, and what we found was that with them reporting to center directors, we didn't really have a good focus on just the sales aspect of the business. So we've kind of changed that vertical and made it so that all sales representatives, marketing specialists, MGCs, they report into a sales function, and that would be reporting underneath myself. And I know many of you probably know Ray Falcon. He also supports Orlando and the Lakeland markets. What I'm going to do is share my screen here briefly. See if I can bring up this presentation.
Yeah, there should be a share button on the bottom for you there too. There you go.
Yep. Everybody see the presentation?
It's loading. Yep, we're good.
Awesome. So with Dedicated, we have a mantra that we speak every day. It's everyone wins when we achieve our vision to be America's leading primary care provider, transforming care of the neediest populations. We honor seniors with affordable VIP care that delivers better health. If any of you have ever taken a tour in one of our centers, you see a big board in the back of the center that shows metrics and things that we have accomplished over the past 90 days, and we stand up and we go over this mantra and talk about daily goals on a daily basis. One of the things that I wanted to bring to light, I know with a lot of changes as far as MSOs, some filing bankruptcies, others reducing the amount of centers. With a lot of the changes that we've implemented here at Dedicated over the last, I'd say, 6 months or so, whether it was restructuring, realigning, a reduction of force, we're positioned very well going forward as far as maintaining the centers that we have, providing the stability and care to our patients, and moving forward. And that's part of the reason why we realigned our sales team to not only go under the sales function, but to be able to better partner with you guys in order to make sure that we're growing our centers and continuing at the pace that we've been doing. Some quick facts, you'll see that we've got 34% annual patient growth rate, 400 to 450 patient panel size. What that means to you is that when you place a patient with Dedicated, they're not going to be overwhelmed as far as the doctor to patient ratio. None of our doctors see more than 450 patients on their panel, which allows us to get patients in on a more frequent basis, also allows us to see them as walk-ins rather than sending them to emergency rooms or urgent care facilities. 95% provider satisfaction, 6,000 doctor agent events held every year, 12 to 15 times doctor facing time patient and appointments per year. So most of our patients will see the doctor at least 12 times a year, if not more. We do this because we believe more in preventative care than actually chasing down illnesses. If we can really get to know patients and make sure that we're ahead of the game as far as things that may be changing in their situation health-wise, we can prevent a lot of ER visits as well as hospital stays. This slide shows 115 plus locations. We're actually up to 135 locations at this point in time. You'll see down there, we're at the map, all the purple dots, those are dedicated senior medical centers, similar to the ones that we have here in Orlando. The green dots are Chen Med facilities that we have in South Florida, and the blue dots are our Gen Care facilities that we have spread out throughout the country. But dedicated seems to be the one that we're growing the most at this time. What makes us different, the doctor-patient relationship, like I mentioned, power of the white coat. Our PCPs are available to assist our growth consultants in events. If you ever want to perform an event, let's say at a community center or any type of relationship where you're going to have a crowd of seniors and you want to have a doctor present, our doctors are more than willing to do so. Our membership growth consultants at each center to partner with agents and brokers like yourselves to acquire and retain patients, agents of record protection. We believe very strongly in protecting your book of business. You'll find at our centers we don't allow captives or agents to come in and just do events where they're sitting in our centers. We want to make sure that we're not flipping any business that you guys are bringing to our centers. And we do that in that manner, as well as making sure that you're listed as an agent of record whenever you sign a patient up with Dedicated. Our total health visits. So this kind of goes to what Justin was mentioning in regards to HRA visits or HRA forms. Our physicians want to make sure that they know as much as possible about a patient before seeing them for the first time. So those HRA forms definitely help in getting to understand and knowing what a patient's previous history was. We also do these total health visits in order to make sure that we're screening patients prior to them seeing the doctor for the first time. We do an echo, an EKG, as well as lab screenings and comprehensive screening questions. But that HRA form also helps quite a bit in regards to making sure the PCP knows full health history of a patient. Our model of care, VIP care, and focus on health outcomes. They have access to our PCPs 24/7. We are outcome focused, meaning that we want to make sure that we are taking care of patients as much as needed. We're not a facility that limits patients to coming to our centers once or once every 6 months or once a month. We will see them as often as needed. Member benefits, direct access to 400 plus generic medications in each location. We have our own med rooms, so we can either have prescriptions filled on the spot or mail them to our patients directly to their home. They get their doctor's phone number, so they have 24/7 access to the doctor as well as an on-call service. Door-to-doctor transportation. All of our patients receive transportation. Doesn't matter what type of plan they are on, location in which they live, we will provide transportation to them. In-house imaging and specialists. We have x-ray rooms within our centers. Some of our centers partner with the x-ray technicians. So I believe our East Orlando location is the only one in the market that doesn't have its own x-ray room, but they're located very closely to our Winter Park location, which does all of their x-rays for them. Strong agent, PCP partnerships, community partnerships, doctor events, and protection of your book of business, as I mentioned earlier. That total health visit that I was referring to earlier, these are the things that are measured. This is at no cost to the patients. We check their height, weight, blood pressure, pulse. We collect blood and urine samples and test for labs. Ask questions to see how they're feeling, as well as a number of different screening questions. We do a simple nerve test that doesn't hurt the patient one bit. And like I mentioned before, we do the EKG and echocardiogram so we can get a better understanding of their heart health before. And this all takes place before the doctor sees them for their first visit. In doing so, the doctor has a very good knowledge as far as what the patient's situation is before actually even laying eyes on the patient. Benefits to you. This is high quality medical care and better outcomes for your clients. Our MGCs will guide the clients through their onboarding process, the journey and beyond. Our MGCs are trained not only to onboard our patients, but to create relationships with them on an ongoing basis. We find that to be beneficial just in case anything comes up and we need to relay them back to you. We also offer priority new patient scheduling. So all of our patients tend to get seen within the first 30 days of establishing a relationship with us, whether that's to see the doctor or at least to get the total health visit screenings accomplished. We have a patient advocate at every center to help address social determinants of health. This helps you out as far as determining whether patients need food stamps, Medicaid, things of that nature. What we do is we relay that information once we find it out back to you as agent of record to protect the book of business and for you to go ahead and dig a little bit deeper as far as any additional needs or services that you can provide for them. How our MGCs work with you. We coordinate and partner at events in the community and in our centers, community rooms. We refer prospects and leads to MGCs for plan changes, from the MGCs to you for plan changes like the Medicaid applications, things of that nature. We send prospects that aren't happy with their PCPs back to you. The goal for us is, one, we want to make sure that the relationship that we have within our centers with the PCPs is one that is positive. If for any reason that a patient doesn't fit our model, we let you know and we assist you with, we have you assist us with making sure that we're transitioning that patient to the right place. We share and introduce community contacts to engage in the neighborhoods that we serve. We tend to have a 10-mile radius around each center in which the MGCs will service. It can go a little further depending on where a patient is located and transportation needs. Co-branding and marketing sponsorship opportunities with both dedicated and HPM. And we sign a PCP during the enrollment period. So, and this has been very beneficial if patients need particulars such as bilingual. We offer Spanish in the market. We also offer Creole and Portuguese, Russian services as well if patients need it. These are the 5 locations currently in the Orlando market. I mentioned East Orlando and Winter Park earlier. We also have Orange Blossom Trail, Fairview Shores, and Hiawassee. My particular locations are that I oversee are Winter Park, Fairview Shores, and East Orlando, and Ray Falcon oversees Orange Blossom Trail and Hiawassee. The good thing about what we've done with the sales vertical is that our MGCs are actually able to go to any center. So if you find one that you're working well with, and let's say they normally will work in the East Orlando center, they can also place patients at Hiawassee, Winter Park, Orange Blossom Trail, or Fairview Shores if need be. So what I would ask is that if you ever have any issues or concerns, or just want some assistance in connecting with one of our membership growth consultants, reach out to me. Here's my contact information. I'm the market sales manager once again for the Orlando market. That's my direct line, 321-313-2910. You can also email me at that email address, sean.thorne@dedicated.care. With that, that concludes the presentation, but I'm more than happy to answer any questions that you guys might have.
Awesome, man. That is awesome news. So we do have some folks that are in other areas of Florida or even outside doing business elsewhere in the country, and you guys are growing like wildfire. Should they just send you the same email just in case, and then you can connect them to their market, or what's
Absolutely.
Okay.
Yeah, absolutely. If you have a dedicated ChenMed or GenCare center in your area, send me an email. I'll be more than happy to go ahead and connect you with someone that can assist you there locally.
Outstanding. And what was your email again? And I'll put it in the chat here.
Yeah, Sean, SHAUN
Mhm.
Thorne, THORNE
Mhm.
at dedicated, DDICATED
Mhm.
.care, CARE.
Got it. Okay, so there's Sean's email. Send him an email if you're looking for a different market, a Sean in a different world, if you will.
Yes.
Absolutely. So I had the honor of hanging out with Kevin McGavick last week, and he shared with me that the MGCs that you guys have on staff are now comped on retaining the members. And that was really interesting to me because, this is about a long-term care relationship, right? This is a long relationship that we're establishing here, both with the MGCs and the agent. So can you talk a little bit about that? I think that's very unique.
Yeah, no, absolutely. So, in trying to create a true partnership with MGCs and brokers and agents, we really want them to be invested, right? So that relationship that they're creating, when you hand over a patient to them, it's like I mentioned earlier, it's not just setting up that first appointment or getting that paperwork filled out. It's really having a relationship, and we are now compensating them for having a continuous relationship ongoing. So once a patient is with us for 1 year, the MGC starts to get compensated residuals for continuing that relationship with the patient. Also getting that patient back to you for any ongoing needs. So yeah, we're making sure that we're compensating both not only on the original sign up, but the continuance of that relationship and keeping that relationship healthy.
That's outstanding, man. I wish I had that when I was doing that,
Yeah.
So one thing that is obvious in what you guys do is you are very aggressive in a good way with marketing. You're in the communities. How many MGCs do you have in the Orlando market, just as an example?
In Orlando, currently we have 27 MGCs.
Okay, so these are 27 people, and their job is to go out in the community, connect with the agents, and help them get leads and sales into your centers. Am I right?
Absolutely, absolutely. They are a very strong workforce. What I like to tell brokers and agents is that it really does behoove you to work with these guys, especially if you're placing patients at dedicated, because more
Mhm.
than likely they're going to run into your patients on the outside, whether that be at a tabletop, a community event, and these guys are very aggressive. We have grown
Mhm.
the 5 centers in Orlando within a 3-year time frame. We're well over 10,000 members. So
Wow.
yeah, we're growing very fast. And you definitely want to be a part of that if if it's a right fit for your patient to be here
Mhm.
at one of the dedicated centers.
Well, I will tell you that it's no secret that some of our top producers are big fans of Dedicated because every month they're sending leads and doing events together out in the community. It's like having your very own marketing assistant that's going to be out there bird dogging for you. So if you're not doing anything right now as far as events, or you're lost, confused, or don't really know what to do, you need to hook up with a pro. And these guys are pros at being out there in the community. It's pretty amazing to see. So, can you talk about what your folks are doing on a daily basis that could help an agent?
Oh, absolutely, absolutely. So we do a lot of, like you mentioned earlier, Justin. We do a lot of events in the community, right? They are tasked with doing at least 15 events per month per MGC, and that
Wow.
can be, yeah. So that can be anything from retail locations, going into housing, food pantries, food drives, things of that nature, community fairs. But they're out there, and like I said, they're very strong. So the goal for the MGC is to always have hot leads, right? And the more you work with them and develop relationships, you're going to find that they're very good at reciprocating, right? They
Mhm.
when they're in touch with these patients or these prospects, um, they ask the questions that would benefit you, such as, hey, do you have an agent of record? Are you happy with the plan you're currently on? And when they have the opportunity, they go ahead and they give that back to you, right? So they find those opportunities to go ahead and make sure that you're getting fed as much as they're getting fed. And that's kind of how we've been able to grow this business so fast, is that we have that symbiotic relationship with both the agents and brokers plus the ground game as far as being out in the streets.
Awesome. Now, you had mentioned that you guys have a program or someone in your center that can assist with Medicaid. Can you expand on that a bit?
Yeah, so what we do is we offer service in the centers, both through social worker and what we call a PCNA. Uh, what their job is if the doctor or someone from the care team identifies that a patient may have a need, they will actually go out or go in and have a sit down with that patient and fill out Medicaid applications, food stamp applications, and then once they get the results back, their job is to then in turn send that back to either the MGC that's on record or the agent of record, which would be you guys, to assist with obtaining the additional benefits. Because if they're starting to qualify for something that they didn't qualify for before, then we want to make sure that they're getting the most benefits that they can.
Awesome. Now, last question, and I'll let you go. You and I are both recovering insurance agents,
Yes.
and we've been around the block. You had a phenomenal career as an agent, and now you're on the other side of the providers. But for the landscape the way that it is now, if Sean was to go back out there and say, "Hey, I'm going to be an agent again," what would you be doing, knowing what you know that Dedicated does?
Um, you mean as far as trying to drive business type of thing?
Yeah, absolutely. I mean,
Yeah.
everything from the partnership to, how would you grow your book of business? We've got some rookies on the call. We've got some folks that have recently transferred in, and we also have some folks that have heard of you, but maybe haven't pulled the trigger. So
Yeah.
yeah,
So
yeah, tell them why they should work with Dedicated. If you were an
absolutely.
agent, what would you be doing right now?
Yeah, no, absolutely, absolutely. I think you kind of hit the nail on the head earlier. The best thing for you to do is to partner with these guys, not only just from a referral standpoint, but it really is the events. Get out there, do events with them. If you've already got things that you've got established, bring them in. Like Justin mentioned earlier, these guys are very good at bird dogging, going out. If you've got to sit behind a tabletop, I wish I had someone like this when I was an agent. They are going to go out and they are going to grab people, whether that be in a parking lot and bring them to your table. If you're at a fair, they're going to walk around and bring people to your table, right? They make your job so much easier. So the benefits are, as far as working with Dedicated, are endless. But if you want to really grow your numbers quickly, work with as many of these guys as you can, establish some good relationships. They are going to protect your business, and they're also going to feed you very well.
Awesome advice. Awesome advice. Sean, thank you very much for your time and attention today. We really appreciate you putting together the presentation for us. You're an all-star, man. Thank you.
Hey, thanks, guys. I appreciate your time. Looking forward to working with you guys. Hopefully we can get together here shortly, do a little mixer or something so that you guys can really get to meet the guys in the field.
Don't threaten us with a good time.
We're working on it. I'm working with Nick. We're going to get some stuff established here soon.
Awesome. Thanks, Sean. All right, guys. Well, that's it for today. We really appreciate everyone sticking around. And again, if you haven't connected with Dedicated, Sean's email is in the chat there. It's sean.thorn@dedicated.care, but you can always reach out to us and we can connect you. support@askhpm.com, or just ask a team member and we can get you connected there as well. But other than that, I hope everyone has a fantastic and productive week. We will be here next week, same time, same channel. All right, everyone, have a fantastic day.